Good evening, everyone. I'm Dr. Kumar, and thank you for taking the time to be here. So let's go ahead and get started. I'm going to share my screen, my desktop. Right. Let's see, let me get this right. Mhm. Okay, here we go. All right. So if you've ever been told that your labs are normal, but you still don't feel well, you're fatigued, unfocused, or just not yourself, tonight is for you. This is an educational session, and I do not want to give any personal advice, but my goal is to help you understand why standard labs often miss the full picture and how to think clearly about your own health. The reason I'm doing this is because those are the kinds of patients that we see the most. Patients who come to us having been told that their labs are normal and traditional medicine, for some reason, is not able to help them. So that was the reason why I ended up presenting this webinar. So let's go ahead and get you started. So the disclaimers. So this is a very common experience. Patients have had symptoms for a long time, and every lab test they have been subjected to has come back normal. Okay, so they go to the regular doctors and basically are told that they had nothing wrong with them, even though they feel horrible. I'm going to talk about this story a little bit, but I just want to give you a heads up on one of our patients that I saw that kind of changed my entire outlook on how to take care of issues. This gentleman came in after having been through a motorcycle accident about 20 years ago with trauma to the brain, stuck in a wheelchair, not able to move much. And his dad would carry him from the wheelchair to the bathroom, 24/7 nursing care for 20 years. And of course, he's in his 40s and all his labs are quote unquote normal. So he's stuck in a wheelchair, nothing much to do, and was basically written off. With the way I figured this stuff out, I literally could make him walk in 2 weeks. We'll come to that. So this is what is missing. Normal doesn't mean healthy. So when labs are done through Quest or LabCorp or whichever lab, they have a range. They have the lower limit and they have the upper limit. And so if somebody has a lab level that's just 1 point above the lower limit, they're said to be normal. Okay. And obviously, if they have any labs below the lower limit, that's said to be abnormal. Okay. But a lot of patients are in that area where they're just above the lower limit of normal. Or there are some labs where you really don't want a whole lot of it. So if they are in a range where they're just below the upper limit of normal, which is still in the range, but because they're not above the upper limit of normal, they're not declared to be unhealthy. So this band of the lower limit and the upper limit of the normal range is really artificial. It's based on population. So, and that population can be wide ranging. you know, and the demographics of that population where these statistics were collected is basically population based. It's nothing to do with individuals. So when we see these patients, we know that there's something wrong with them because their symptoms kind of goes along with what I call is abnormal, but according to traditional medicine, according to the normal lab range, they're said to be normal. And that's the dilemma that most patients are stuck in. And so when I'll give you a typical example, and by the way, I'll keep track of time so we don't want to go overboard. We'll give time for Q&A later on at about 30, 40 minutes out. So just bear with me on this because this is difficult for a lot of traditional medicine folks to understand this. And so, which is the reason why people are kind of stuck because even though their labs are normal, they're barely within range. See? So that was my first aha moment. So obviously, if the labs are off the charts, we know there's something major going on. You don't need a rocket science to figure that out. Okay. So that requires traditional medical care. So, and I kind of came across this thought of defining three levels of care. And the reason I came up with these three levels of care is because when people were asking me, what do I do? And I would say I'm a functional medicine doctor or an integrative medicine doc. Very difficult to kind of explain to them what that means. So I came up with what I call the three levels of care. Level 1, level 2, and level 3. So that's what we're going to talk about. So level 1 is when the forest is on fire. Okay. Somebody breaks a bone, somebody has heart issues, breathing issues, pneumonia, infection. That's level 1. Okay. You need traditional medical care to address that emergency. Okay. No question about it. Level 2 is so in other words, if patients come to me with level 1, what I tell them is, hey, listen, you really need to get to the emergency room, or you really need to get to your primary care doc or your cardiologist or whoever. Because if I put on my MD hat and evaluate them, and I know there's something major wrong, and I know that I can't help being a functional medicine physician, but they need the care right away. So we know that the labs are going to be off. So we got to take care of them in the hospital, emergency room, cardiac care, whatever, based on the condition. It's at the level 2 where we get into these major issues, like I explained to you, where the labs are quote unquote normal, which means the patients are still suffering. They still have a lot of issues, but because their labs are under the normal range, basically there's nothing that traditional medicine can do, and they just, you put some band-aid on, pain medicines or anything symptomatic just to tide them over. And so, I mean, that's the extent of how traditional medicine has been taught. In traditional medicine, we are taught to take care of crises issues, emergency room issues, anything where the numbers are off. We know how to take care of them. But at this level is where traditional medicine gets stuck, and this is where you really need to put on a different hat to figure out what's going on. And this is where our expertise comes in. I mean, I tell my patients, this is like putting on the hat of Sherlock Holmes, trying to figure out what's wrong. And this requires careful listening, evaluation. Okay. Symptoms are there. Okay. Typical example I can give you is somebody with chronic fatigue syndrome. Traditional medicine labs say it's all normal. Or if they find something abnormal, they fix it, but the patient still has massive symptoms. fatigue, tiredness, insomnia, you name it. So when we get those patients, we have an issue, but we don't get a pointer on. In other words, we have subjective findings, but objectively, there's really nothing much that we can hang our hat on. So instead of going down the route of just treating them symptomatically, we have to dig a little bit deeper to see, even though the labs may be normal, which shows that there is no fire, but we have to suspect that there is smoke somewhere. And so there's a whole slew of tests that have come out that dig a lot deeper rather than what is available in under insurance-based traditional medical care. I mean, that's what that is. Again, you have to be selective on what kind of labs you're going to look for. I mean, most people just throw $5,000 worth of lab testing. What are you going to do with it? So when you make a decision on what you need to optimize, you need to have a game plan in mind, which means if you do a lab test that can get up there in terms of pricing because it's not covered by insurance, you want to make sure that you have an actionable basis for that, which means if the results of this lab test comes up as A, I have a game plan A. If the results come back as B, I have a game plan B. If I don't have a game plan, then what's the point in doing that test? And this is my biggest beef with this whole area of functional medicine and integrative medicine. Again, we do the best that we can. But this is just my opinion. This is my way of looking at things. This is my way of figuring things out. Because at the end of the day, we want to make sure that the patients get results. You don't do stuff just for the heck of doing it. You don't run a test just to sound impressive. You have to do a test that is meaningful. You have to be aware of the costs involved and the logistics and all that stuff that comes into play. So you really have to be careful and be aware of all these nuances. A typical example that I can give you is men with low testosterone. This is the most misunderstood area that I see in the functional medicine, integrative medical area. They come in with all kinds of issues related to low testosterone, but the labs are quote unquote normal. Now, that normal is based on the population. It's not based on their individual issue or in their individual persona or their medical issues. It's very unique to them. So what is normal for the population may be low for them. So you really have to figure this out. And there's a way of teasing it out. But that's how we look at these things. And I'll tell you why I've classified these issues into 3 levels. Now, level 3 is when patients come to us and they come in for what is called peak performance, longevity medicine. At this level, which means they have no level 1 issues, and whatever level 2 issues that they have had have been helped out, taken care of. And now we can afford to talk about health optimization. Somebody with a broken hip at level 1 care come to me and talk about age reversal. What's the point? You see? Or if somebody has major issues at level 2, why would I waste time, energy, and money in checking their biological clock? What's that going to tell me? Because we know it's not actionable until we solve the whole problem. We need to take care of the fire at level 1. We need to take care of the smoke at level 2. Once that is clear, and now we have fertile territory, and now we can seriously think about age optimization to a point where you can even reverse biological age. We have the resources and labs and so on and so forth that can help in that area, but provided we select our patients right. So I had patients who come in with all kinds of medical issues, and the first thing they tell me is, oh, I want age reversal. I mean, if your hemoglobin A1C is 11.5, let's fix that first. Let's figure out age reversal later on once we know we have taken care of whatever is totally out of whack. And so this is a conversation that some patients really don't want to hear, but a lot of patients are very impressed because we know that this is a journey. This is not a band-aid. Okay. Taking care of patients who crave health optimization is something that we've seen recently with the whole area of what's called longevity medicine coming into the awareness of the public, especially in the US and especially in Silicon Valley, where these billionaires are spending tons of money in trying to achieve longevity. And there we can talk about health span and lifespan, optimizing that. But like I said, for most people, you have to walk them through the level 1 process, the level 2 process, and the level 3 process. So that's what that is. So coming back to this gentleman who had brain trauma 20 years ago and stuck in a wheelchair, what would I do? So we checked his labs, nothing wrong with it. He's 40 years old, basic labs are okay, and his underlying issues, whatever the deeper dive, I'd not do a whole lot of testing on it, but whatever we could do were all clear. But even in that case, you have to take a systems approach. As long as you do not do any harm, and the system that you're thinking of in terms of helping him makes sense. And this is what I did for him. In fact, his video is on YouTube under my channel. We did what's called ozone therapy. Now that's a whole different webinar that we'll probably be talking about, in upcoming months. But basically, when people have given up hope at level 2, which is a lot of patients, much more than you can imagine. And the main issue at level 2, not just the physical part, but it's the suffering. That suffering is not only on the patient, but the entire family gets affected. So finding ways of trying to help level 2 patients is where we really, really excel at. So when people ask me what I do, my whole passion is to help take care of patients at level 2. And once they get through level 2, I would discuss level 3 health optimization with them. Level 1, no, I make a referral. But I do help them out in my own way to make sure that the results they obtain at level 1 is optimal, which means if somebody has, let's say, broke a bone, okay? Somebody who's elderly breaks a bone. Now, according to traditional medicine, you fix the bone, you fix the broken bone, you send them home. But what's missed out is the reason why that bone was weak. Was there underlying osteoporosis? Was there an underlying hormonal imbalance? Was there an underlying thyroid imbalance? So at level 1, there are opportunities that are available in the non-traditional medical area where you can really go out of your way to help them out, recover faster, feel better, get back to work quicker, get on with their life quicker. And I can cite dozens and dozens and dozens of patients that I've been able to help out. So that's in summary level 1 and level 2 and level 3. So in this gentleman, that we did ozone on from being stuck in a wheelchair for 20 years. After a couple of sessions, he came in with a walker, from the wheelchair to the walker. A couple of sessions later, he came in with a cane. And a couple of sessions later, he comes in, no cane, and he's jumping around. And this was in 2022. He's still jumping around today with nothing else that we had to do on him, nothing else. It's an amazing story. Again, in this area of medicine, one word that comes up very often in what I do is healing. Now, that's a very vague word, healing. Everybody says, oh, I got healed. But seeing these kind of situations where people have given up completely and with no hope, we've been able to give some kind of relief. And people say, oh, that's unbelievable. You're right. It is unbelievable. But I know the system works. So if you use the right system, using the right resources, it doesn't have to be expensive. That is simple. And always with the underlying principle of saying, do no harm. Do no harm medically and financially and mentally. Those are the core principles that really help us provide the services that we do. So it's not a miracle. It's asking better questions, better framework, and better decisions. So this is what I want you to take away today. One core message: normal labs don't always mean that nothing is wrong. Understanding comes before intervention. That applies only for level 2 and level 3, and partly level 1. Level 1, emergency room, traditional medical care for the most part. And you can tag along some of the other stuff that we did that's not allowed by traditional medical care, and that's okay. So do not get carried away by labels. I hear this on and off. I don't like traditional medical care. Oh, I love holistic care. Doesn't matter. Focus on results. Don't get stuck on labels. You can use the best of both worlds, and why not? We've spent trillions of dollars in coming to where we are with all the research that we've thrown into traditional medicine. We have a lot of good stuff in there. Do not ignore it. The message is clear. It's the people who are delivering that message do not have the means of communicating the value of what they bring to the table in that area. And I think that's the issue, why we have this polarization. In my world, there is no polarization. What helps patients? What gives them results? What gives them results is both subjective and objective, which means, yeah, your numbers are looking good, your labs are normal, but you feel like crap, not my job to take care of you, move on. Or here's a Band-Aid, go away, don't come back. So the subjective part of medicine is one of the most ignored pieces of healing. And that is a big, big, big chunk of what is missing. Again, I don't have to blame anybody. It's just the way the system is created. There's nothing wrong with every doctor out there. They've spent their blood, sweat, and tears to come to where they are today. It's not been a simple ride for any one of us. But either we're so tied in with our daily grind that we miss out this big piece. And what I've done is to come in and bring that part into medical care. And that's what we love doing. So, any questions and answers will depend on individual context. And thank you for your time. Hope this brought clarity. And if next steps are optional, not urgent, that's my contact information. This is the best way to keep in touch with me. Okay, if you guys can, just write down this website. It's called drkumar.substack.com. You have to sign in, and you'll have access to a bunch of newsletters, health tips that I put out there that can help you. I'm not going to overwhelm you with a whole bunch of crap. Trust me. I don't want to waste your time. I'll give you what really matters. And these are things that generally are not available either through AI or through Google searches or through any of your doctors. So I try to bring my way of thinking into solving these medical issues. So next month, 4 weeks from now, we're going to be talking about this topic, antioxidants. Everybody and their uncle is on antioxidants. Tons and billions of dollars is being spent on antioxidants. So I'm going to set the record straight on this. Okay, what most people get wrong, what actually helps, and what can quickly backfire. And what we'll unpack is what antioxidants really are, when supplements help and when they hurt, why timing matters more than dosage, and what's the most powerful oxidant most people ignore. And one surprise, the best oxidant on the planet is antioxidant. Sorry, that's a typo. The best antioxidant on the planet is free. Some of you folks who may be listening to me already know what that is. I have a code word for it. It's called vitamin G. Go figure it out. And this is available to anyone who lives on land. So there's a little tip in there for you. If you are curious, go figure it out. It's available to anyone who lives on land. And it's closer to you than you think. So if you want to get that answer, tune in on February 11th. I'll send out an invite just like we did for this. All right. Let's see. Question here. Are parasites real? That's all we are hearing about parasites in our body lately, and they're trying to sell us all these parasite cleaners. All right. So it's a very common question that I get asked. And so this is my take. Okay. I grew up in India. And when I finished medical school, I became a pediatrician, take care of kids, okay, for 2 years. So as you can see, I've gone through several iterations of where I am today. So you can call me as Kumar 5.0 today. So Kumar 1.0 was a pediatrician. We're talking about decades ago. And living in a metropolitan city, we used to see tons and tons of kids. We did not have the resources to do stool exams, blood work, or whatever. But we knew the epidemiology of what was going on in our community. And that was worm infestation, either obvious or not obvious. And they would come in with symptoms that are typical: malnutrition, unable to thrive, weight loss, all kinds of issues. We had to assume these were worms. And we would just give them worm medications. That's it. And it would work. We did not have the resources to examine every child. I mean, I would have 100 kids standing in line, standing, no waiting rooms. And I would sit in a little chair and I would see them quickly, like 30 seconds a patient. We just had to assume things and we did the best that we could. It was not perfect, but that was the best that we could. And we saved a lot of lives doing whatever little that we had. It was kind of disappointing, but at that time, we just desperate to take care of as many kids who needed us. And that's exactly what we did. So we had to assume that parasitic infestations are very common in India. Okay. And we would give out these medications like candy. So what are we doing here? Now, the key here is this. When we're talking about parasitic infestations, they have a whole side of the us are in our body, many of these infestations, but we have no way of testing it. We just don't. We had to assume. So the only way that you would know that you have worm infestation is, do you come from a high risk area? Are you a farmer? Are you somebody who would farm animals? And all this history, it can count. And also, have you had any obvious, you know, worms in your stools or whatever? Okay. Many of them may not even show up. They're subclinical. Okay. So when you have issues that are not solved, again, I'm looking at level 2 care, where you have these mystery illnesses, okay, and you have no way of proving or disproving. I mean, let's say you do a stool test and it's negative. What are you going to do? Doesn't mean that you don't have parasites. They may be inside you, but we just don't know. So there are a whole lot of bacteria, viruses. I mean, we are exposed to this environment that we live in. And science can only pinpoint a diagnosis in a small minority of these conditions. So we coexist in our environment, exposed to all these things. So how do we know? The way we know that is at level 2, you have symptoms and you figure out, put on your hat, and you can give a trial of parasitic medications, anti-parasitic medications, and see what happens. If things get better, you got your diagnosis made. But this is one of those conditions where obviously it's not level 1, it's level 2. So you got to put on that thinking hat, figure out if there's anything else. Again, this kind of an issue with parasites, I don't think is that common. I think there's a whole information set out there, probably for whatever reason. But I don't jump on it as my first diagnosis. The most common conditions that we see in level 2 are hormonal issues. That's the one that's missed the most. Thyroid issues. Again, I'm not talking about drastic issues. No, those would belong to level 1. I'm talking about subtle issues where traditional medicine calls it normal. So those are the issues that we really need to go after. So it's, again, you got to put on a detective's hat to figure this one out. So I generally don't jump on it, on treating parasites willy-nilly, because they do come at the cost of side effects. And is it worth it? But most of them are safe. And again, I have the experience of dealing with these medications, a truckload of them in India. So I know but again, you got to do it for the right reason and track it. Just don't give the medication and walk away. Does it work? Have your symptoms resolved? Those are things that okay, here's another question about the brain supplements like Prevagen. Awesome. Well, there are thousands and thousands and thousands of supplements on the market. And I can go into a lot of detail about supplements. In fact, I'm going to be posting a whole um, a write-up in my Substack. I'm going to give you a whole lot of details because this is an industry that has very little oversight. Any one of us can sell supplements, literally, because FDA does not control it. FDA will come in only after people have been hurt from a supplement. So we can, as long as it's not hurting you, we don't know if it's helping you. Having said that, for brain health, there are legitimate ways of helping brain health. You don't have to go through the route of Prevagen, or for that matter, any other supplements. There are selective supplements that will work. And it's a long discussion. That itself is a whole, like a 3-day webinar. We can talk about it for 8 hours a day for 3 days or a week. Easy. And there's a lot of misinformation out there because anybody can get away with it. And it sickens me to see these ads on TV. They must have spent thousands of dollars on these TV advertisement, which means they're making a return. So those ads are paying, uh, they're getting paid. So they're making money doing these things for them to have the capacity to spend that kind of money in advertising. So that's my take on that. So you got to be careful. So I have my own way of thinking about supplements. So it's not for everybody. And my bottom line is don't waste your time, energy, money on supplements. Talk to one of us, talk to a functional medicine doc. Make sure you're doing it for the right reason because there are more proven ways of helping you guys out without having to stay on something for the rest of your life, which is what the supplement companies are. Once you're hooked, you're with them for the rest of their life. When are you going to stop? You're always hoping and praying that it's going to work. And if it doesn't work, it's not the product's fault, it's your fault. You're not doing it right, or you missed a dose. So, so that's my take on things. So there are several things we can do for brain health. I mean, that's one of my passions. And guess what? The number one way of preventing brain health in postmenopausal women, number one way of helping them is hormone optimization, BHRT, bioidentical hormone replacement. Works like magic. Any other questions? If you guys have time, I want to see if I can show you one other slideshow that I had. Anyway, all right, I think we'll call it a day. All righty. Anything else? So hopefully you guys can join me. We'll do this once a month. I picked the second Wednesday of every month, unless we run into a public holiday or something like that. Okay, but I'll keep you guys informed. So thank you so much for bearing with me. And just by the way, hey, Anne Marie and my wife warned me about making sure that I stay away from using my languaging skills. So I wanted to be a good boy today, and which is what I did. All right. Everybody have a good night. Thank you so much. We're done. All right. Thank you. Stop recording and over and out.